So I want to say hello and to welcome everyone to Marketplace Room for Digital Health. You're in the right place. We have three very interesting and innovative presentations for you today. I'm Kieran O'Dowd. I'm the Communications Officer at PMNCH. We're the co-host of this summit. And I want to thank you all for your participation, especially our presenters today. So I'll introduce the presentations. We have three today. Each will be about 18 minutes total. We'll have a 10-minute presentation followed by about 8 minutes of question and answer. So please post all of your questions or comments in the chat, and I'll be monitoring that and bring those questions up to the presenters. So let's move on to our first presentation. So I want to introduce Miluzka Baca and Ysis Roja from the Universidad de San Martín de Porres in Lima, Peru. And the title of their presentation is Mitigating the Effect of COVID-19, Distance Counseling Alternatives in Sexual and Reproductive Health. So over to you, Ysis and Anna Miluzka.
Good morning. First of all, we would like to thank the organization for the opportunity and you to be present in this room. I'm Ysis Roja and my colleague is Anna Miluzka Baca. We live in Peru and work at the University of San Martín de Porres. This morning, we would like to share with you a couple of projects that we are developing at the university. Could we see the video?
Sure, yeah.
Thank you.
In these moments of pandemic and mobility restriction, the population, especially the vulnerable, has stopped attending the consultation for fear of contagion and various reasons such as hospital focus on patients with COVID-19, absence of health professionals who have been quarantined, does not have its own mobilities, have run out of work and have no resource. We know it is not the best decision, but there are valid reasons to stop going to the consultation. However, we already know how catastrophic it can be to not receive sexual and reproductive health care. Past epidemics showed us that the effects on sexual and reproductive health were the indirect consequence of interruptions in care and the redirections of resources in the health systems. In this situation, it is necessary to think of proposals that, without demanding economic resource from the states, can organize attribute value, use available resource, contribute to the unmet needs of various groups, and strengthen the health system. That's how Cuscaya was born, which is in Quechua means together. Cuscaya is a digital platform that integrates normal triage and COVID-19 detection during pregnancy, childbirth, and postpartum. Articulate care between the retired midwife with experience in primary care, the midwife in the primary care activity, and the last year student in midwifery. The first has been confined due to her age, but her experience is useful for user care. The second continues to attend the health center responding to the needs of the pandemic situation, and the third at a key stage of learning, but due to the suspension of educational activities and the need to avoid exposures to the risk of COVID-19's contagions, they have canceled their possibility of achieving their educational objectives and thus their professional objective. The first phase of Cuscaya is when the user registers on the platform attaching evidence of pregnancy. The information entered is validated by the primary care center midwife who includes it in Wawaret and provides the platform access codes. Thus, start the triage process, which allows to evaluate the clinical risk for the proper management of the user with or without COVID-19. Also, the attention is predominantly virtual, and through the platform, at least 3 coordinate visits are necessary for users. The first visit serves both the COVID-19 triage phase and the care phase, as the quick test and laboratory battery will be performed. In a second coordinate visit, fetal well-being will also be monitored And a third visit to the postpartum phase, visit that expect to be supported by the Ministry of Health and social agents such as regional or local governments that could facilitate visit through their mobile units of municipal centers. In the same sense, this pandemic limited adolescents and young people to access timely sexual and reproductive health care. For this reason, many of the converse only with their peers and obtain information from the internet, which are not always a reliable source of information. However, this group was always one of the most neglected. Thinking about it is that Telenano was born from the union of telemedicine, artificial intelligence, and counseling on sexual and reproductive health. The main character is Nano, which means confident in Quechua, which through a chatbot has the main objective of providing scientific information and available in an open and confidential space for young people and teenagers. Works on the Face platform so that the user has an open channel without having to download a new applications in a language familiar to users. Telenano's artificial intelligence engine operates on the 5 steps of counseling, establishing a friendly relationship, identifying needs, responding to needs, verifying understanding, and maintain a cordial relationship. Both platforms proposed by research from the Universidad de San Martín de Porres are born from initiative to respond to the demands of society and mitigate the effects of the COVID-19 pandemic on the most vulnerable population of our country.
Yeah, now I would like to talk a little more about the context of these two projects. In Peru, our president, Martín Vizcarra, followed the best advice when the first infected patient of COVID-19 was identified. One of the first and strictest confinements in Latin America was ordered, and one of the largest financial aid packages was launched to make it easier for us to stay home. And it seemed that we were well prepared to face the pandemic. However, in a few weeks, instead of being applauded as a model country, we have become one of the most critical epicenters of the coronavirus in the world. This epidemic exposed inequality and corruption that have been deeply rooted here for many governments. Both have hindered the response to the pandemic. A collapsed health systems, professionals with useless personal protective equipment, professionals in quarantine for chronic disease, but also for having been infected, are some of the sad news that we hear every day. However, there is a clock that keeps ticking, and that is the health needs, especially the sexual and reproductive health needs of our most vulnerable population. This is the case of our pregnant women who every day without care put their lives, the life of their babies, and the well-being of their families at risk. So, in a country with a clearly damaged economy and a health system that is already suffering the consequences, we need to prepare proposals that mitigate this impact. But at the same time, these proposals must identify existing resources in society and provide them with value for this important task. This is how Cuscalia was born. Cuscalia, as in the video, means together in the Quechua language, a language native in Peru. Cuscalia is a care platform for our pregnant women and women in the postpartum stage, infected or not infected with COVID-19. This platform differs from other existing ones because it responds to two important specific situations, in addition to the vital health care of our patient, of course. These platforms allows, first of all, to take care of the mental health of a group of older adults. Our retired midwives are in isolation, and with their mental health at risk, we must offer them the possibility of having some activities that can keep them active during the long hours of social isolation. Secondly, this proposal aims to reduce the gender gap. The last year of health careers chosen preferably by women, has been canceled. and they are facing the difficult situation of losing the academic year. For us, as professors, this has also been a really difficult situation to understand. And we believe that this situation puts them at a clear disadvantage compared to a student of the same age and in other careers. The care provided to the patient in that platform, in coordination with the primary care midwife, can be considered a part of the evaluation of the senior midwife student, because we are aware of the need to keep the student in isolation, a necessary isolation due to the fear that they will become infected with COVID-19. But we must be able to offer them an option to finish their careers in the time that they determine for their lives, as much as this is possible. Thank you so much. Now I leave you with my colleague, Miluzka, who will tell you about Telenano.
Thank you, Ysis. Well, all of us at any point have left lost during the adolescent and youth. There are no easy stages, and even more so if we have to talk about sexuality or make decisions around it. Now, imagine that the few spaces you have to be heard and attend are closed. That is what has been happening in the world due to the COVID-19 pandemic. Currently, Peru is the 6th country with the most reported case of this disease. On average, 4,000 cases per day increase, causing our fragile health system to collapse. Every day, more, and with it, more resources are also allocated to the attention of the pandemic, leaving aside other health needs such as sexual and reproductive health. The closure of sexual and reproductive health service limits adolescents and young people to access timely care. For this reason, many young people and adolescents choose to talk about these issues with another young people or adolescents, most of whom probably obtain information from the internet. Thinking about the gaps that were before the pandemic and those that the pandemic has caused, we create this chatbot strategy. Telenano, that's mean teleconfident, is an open space in Facebook for our young and adolescents. In addition to the chatbot, we provide scientific information about relevant sexual and reproductive health topics in closer language. Also, we are in the process to incorporate a system for recognize previous information provided from the users. We know it's pandemic times, but the rights continue to be our rights. Now, I invite you to visit Telenano Facebook. Thank you.
Well, thank you very much, Ysis Roja and Miluzka. We really appreciate that presentation. So you mentioned Peru in terms of being affected by COVID and it really paralyzing the health system. What was the, you mentioned it was number 6, I think, in terms of COVID infection in South America, is that correct?
Yes.
Yeah, okay. So what specific challenges, what do you think was your major challenge or obstacle to overcome in releasing these products?
The first problem, I think that is the economic problems, but maybe for the corruption, because we had a very important position in Latin America, but today buy supplies and maybe, I don't know, have attention for everyone, it's a really problem, no? Useless equipment, buy useless equipment, no? It's a problem. The corruption is a big problem in Peru.
Great. Are there any questions or comments from the group? If you want to type them into chat, I can voice them to Miluzka or Ysis Roja.
Yeah, hi, Anna and Elise. It would be really great if you can put maybe your organization web link or the project, the link in the chat so we can all, you know, look at it later. It's a really interesting intervention. So thank you for that.
Yes,
Yes.
we can write in the chat for Telenanos, right?
Yes.
Yes.
Okay, let me find it.
And Ysis Roja is a psychologist. She's a master in public health with mention in sexual and reproductive health, a researcher and professor at the Faculty of Midwifery and Nursing at Universidad Torres. And Ana Miluzka de San Martin de Porres in Lima, Peru. And Ana Miluzka is a midwife, master in sexual and reproductive health. She's a researcher and professor at the Faculty of Midwifery and Nursing. And they actually had two separate entries into the marketplace submissions, and we asked them to combine those submissions. So Ysis Roa and Ana Miluzka, if you can just tell us how you work together at the Universidad de San Martin de Porres, that would be very interesting.
Thank you.
Thank you. I write the link in the chat. For
Okay. And do you both work together very closely at Universidad de San Martin de Porres? Do you have different target groups that you work with?
Yes, we are young and adolescent, and young and adolescent, and Ysis with pregnant.
Oh, okay, great.
Yeah.
Okay, excellent.
Mhm.
So we have a question in the chat. How does Talenanu also provide links to the marketplace for sexual health products? Do you have any plan to develop an app beyond the social media platform?
Okay.
So Ysis Roja or Ana Miluzka, do you have any plans to develop an app beyond the social media platform that you're using for Talenanu?
I think that she is working with Facebook because Facebook is the platform, the most recognizable for the adolescents, no? I work Kuskaya with a national platform because I want to integrate the platform with the national program, no, with the national platform. But I think that Ana Miluzka wants to work with Facebook because it's the app for adolescents, no? Everyone knows Facebook. No?
Yes, in Peru, we continue to use the Facebook, and adolescents and young people use Instagram too, but we prefer Facebook. We go because we know all the adolescents and young have Facebook in the cell phones. Our young adolescents doesn't have enough resource to get a super special cell phone and to get another app. And we prefer to use Facebook for that reason.
Okay, great. And how does the national platform communicate with each other? Is it through WhatsApp or through Facebook?
No, the national platform does not work with social networks. Well, not until now. I don't know in the future, but not until now, no.
Okay, great. And do you have any information about the analytics of the traffic, the age of the frequent users, the quality of interaction?
About Telenanu, no, actually, we don't have this number, but we have a lot of consultation in the platform. with young and adolescents. We receive, yes, in the chatbot.
Like a lot of interaction, right? Okay, great. Well, thank you so much, Ysis Roja and Ana Miluzka. We really appreciate that presentation. It was very interesting and really enjoyable to hear all of your hard work. And it was such a great response to COVID, such a devastating situation in your home country. So we do hope that it gets better for your country, and we applaud you for all of your hard work. So thank you very much.
Thank you.
Thank you.
Thank you.
So now we are going to move on to Medic Mobile. So we have Helen Olsen. She's an impact manager on the research and learning team. And then we have Simon Mbae, who is a partnerships manager, East Africa for Medic Mobile. And the title of their presentation is Adapting Digital Tools for Primary Healthcare Continuity. So over to you, Helen and Simon.
Thank you so much, Kieran. I'm actually going to shift this over to Simon really quickly, but we're excited to share a little bit about Medic Mobile's response to the COVID-19 pandemic, and specifically, we're going to talk through how we've used the Community Health Toolkit, an open source platform focused on community healthcare worker engagement with communities at the last mile, to really help drive adaptations to primary healthcare workflows in response to COVID, and also with an eye towards health system strengthening beyond the immediate pandemic. Simon, over to you.
Thank you, Helen. Just a moment. Thank you very much. So good evening, good afternoon, good morning. It's a pleasure to be here. My name is Simon Mbae, as Helen has mentioned, working at Medic Mobile. And Medic Mobile is a non-profit organization with a deep focus on human-centered design. And our mission is really to advance good health and human flourishing. And how we achieve this mission is through the use of our open source Community Health Toolkit platform. And we work at community health systems mainly to reach the hard-to-reach populations. We envision a world that is just, a world where healthcare workers are supported to provide care, a world where universal health coverage is a reality, and a world where health is a secured human right. We also believe that community health programs can deliver decentralized, integrated, equitable, quality, and coordinated care. In these times of COVID-19, like everyone else has experienced them, conditions are not the same. It's a new normal that every one of us is trying to get adapted to. And certainly the community health workers and other frontline healthcare workers who use our tools to deliver care, and especially doorstep care on a day-to-day basis. COVID-19 has actually disrupted primary healthcare services. And this has been significant. Over the period from March to date, we have seen significant disruptions in essential health services delivered by frontline healthcare workers, such as community health workers. And these services include assessments for children under 5 years, and this is for malaria, pneumonia, and diarrhea. We've seen also decreases in household visits conducted by these people. Again, we've also seen decreases in essential maternal child health care. And if you look at the group that's significantly getting affected here are the most vulnerable, the mothers, pregnant women, and the children. We do believe that to be more effective, we need to build on what's currently existing. And to be sustainable, we need to take advantage of collaborations and partnerships. for which have led us to where we are today. If we look at our priorities for responding to COVID-19, we've sort of broadly categorized them into three. And allow me to focus on the second one, which is routine care, which primarily focuses on how primary healthcare has been affected, and also looks at how do we support the frontline healthcare workers who are delivering these services on a day-to-day. We realize, again, that it is not business as usual. And there's a very famous quote in Kenya from our Cabinet Secretary of Health, who says that if we behave normally, then COVID-19 will treat us abnormally. So we have to make certain adjustments. And so have we made in terms of how health services are being delivered at the community level. We've had to go back and rethink, what do the protocols say around service delivery during these times when there's limited mobility, there's limited physical contact, there's inadequate personal protective equipment, and how do we continuously ensure that primary healthcare services are being delivered even in the wake of local or community transmission of COVID-19. So we've made certain adjustments and working with partners who are already implementing our tools across Africa, Asia, and Latin America, a network of about 25,000 healthcare workers. We're looking at ways through which we can be able to adapt those protocols and reflect them in the care protocols and service delivery protocols that community health workers use to deliver care on a day-to-day basis. Training and practice are really intertwined. And for the community health workers to be able to deliver up-to-date services that matches the current protocols and what research and evidence says, then training is a critical piece to this. We are looking at how then training can be delivered safely. We are again looking at the element of time and scale at the same time. For this to be effective, then it has to be delivered at a much faster rate, and it has to be scalable as well. We are working with a vision for a technology that's more sustainable as a national tool that can be adopted even post-COVID-19. Again, we're looking at how we can be able to measure impact and uptake of this training content, and also to provide or point out areas where additional support is needed, say by those supervisors who provide mentorship and coaching for such people. I'm going to play for you a very short video, about 1 minute and 40 seconds, so that it gives you a rough idea of how we are adapting our open source platform to be able to deliver training content remotely and at scale. Don't worry, it doesn't have to have audio. You can just read through the content. So that's a screenshot of how our mobile application looks. Thank you. What is also equally important is the balance between the frontline health worker safety as much as they're delivering services to those that need it the most during these difficult times. And with this, we've been able to work with other open source technologies such as Rapid Pro to be able to come up with text-based workflows that are very interactive, to also make sure that we are screening for symptoms of COVID-19 amongst these frontline health or care workers. As they deliver services, they're also exposed to COVID-19. And so it's essentially very important that we are able to check routinely, as much as daily, to identify whether they are getting any symptoms of COVID and link them up to the appropriate care that they need. In addition to that, we can all attest to how COVID-19 has put us under significant mental health challenges, especially when it comes to measures such as physical distancing, restricted movement, and also the fear and worry of the imminent COVID-19 ever so present within our lives. And so using SMS-based workflows, we can be able to evaluate mental well-being of these frontline healthcare workers who, as much as they are supporting other people, we also need to strike a balance and ensure that, again, we are evaluating how well they are coping with these situations and also linking them up to services when they do need them. Equally important to call out is that we cannot do this by ourselves. We all know that global health challenges is bigger than any single one of us or any single organization. And it is through partnerships and collaborations that we have seen as much a response as we're seeing in each one of our countries. And so is Medic Mobile, as I'd mentioned, working with other open source tools. We do not want to reinvent the wheel, rather strike very strategic partnerships and collaborations with like-minded organizations, multi-sectoral collaborations to be able to pull off some of these things that we are demonstrating here. We're looking as well at integration with other open source tools such as OPM Mobile. As I had mentioned earlier, we are keen on building not just technology for COVID-19, but technology that can be adapted and owned by governments as part of continuous health system strengthening. We have been able to make, as I had earlier said, that make our tools truly open source. And we have open sourced our tools, our resources, and built a community around CHT. And it is through working with these communities that we have been able to get to where we are. We have a very active community that is vibrant at discussing not only COVID-19 at the moment, but also other areas around technology and how technology can be adapted to provide other essential services during these difficult times. And we are happy to invite you to visit communityhealthtoolkit.org, where you're going to learn a lot more about the other workflows that we've done in response to COVID-19, where you're going to also share your thoughts, whether you are a technical organization or a partner or an implementer, or even governments that we've been able to work with. It's a space where we can all exchange learnings, experiences, best practice. As we are here speaking about what we've done, we are not presenting a solution, but rather presenting an idea that can be harnessed through collaborations. And we invite you all to join hands with us to take this work forward. I'd like to stop there and happy to respond to any questions, comments, suggestions. Thank you very much.
Thank you very much, Helen and Simon. That was excellent. I have a general question for you, and then we'll get into the more detailed questions from the chat. But you are in Kenya, so is this available in just Kenya, or is it available in other countries as well?
So we're not building this for Kenya only. So as I mentioned, we have a network of about 25,000 users of our tools distributed across Africa, Asia, and Latin America. And we're working with implementing partners who are keen on adopting this technology, and not only the technology, but also the training content. We are looking at working with one of the partners in Uganda for specifically COVID-19, but again, we are building a solution that can be customized even beyond COVID-19 to relay any other training content.
Okay, great. And we know in some of these low and middle income countries, the access to the internet is not always great and the penetration is sometimes low. So what do you recommend for people that don't have access to the internet? How can they take advantage of all these services?
Yes, and we do recognize that the communities that we actually serve work within very constrained environments. And therefore, taking that into account, we have an SMS-based platform as well that can provide two-way interactive chats or content or messaging. And we have done significant research work around the effect of or impact of two-way texting as a means of care coordination for services such as voluntary medical male circumcision. And we're also exploring the same approach for delivering content for people within areas that internet connectivity might be a challenge.
Great, great. And in terms of reminders, does the system send reminders to pregnant mothers for antenatal checkup and vaccination for mothers and children?
Yes, so the system does comprehensively cover the scope of community healthcare workers within the health systems that we are working in. If I was to speak to the Kenyan context, there is quite a lot that community healthcare workers do, and certainly everywhere else where you have those frontline healthcare workers. They've actually been roped in to make sure that services are sort of decentralized and can be delivered at doorstep, and mainly to enhance linkages between community and the health facilities. So in terms of reminders, those reminders could either be relayed through the community healthcare worker who is a link to the households, because predominantly at the household level, sometimes devices might be shared. Not every pregnant woman might have a device. So absence of that, then we would rely on a community health worker. But definitely in terms of sending reminders directly to the patients, that's definitely something doable.
Excellent. And what is your experience with Opia Mobile? How do you ensure you don't duplicate other digital efforts?
Exactly. And the reason why we are collaborating is so that we don't duplicate. In fact, right now there is an active partnership going on between Medic Mobile and Last Mile Health through Community Health Academy, and trying to find ways that we could integrate practice and training at the same time. Our platform is very critical for community healthcare workers as an accompaniment to make sure that they are guided on how to deliver standardized care, quality care, and integrated care. Opia Mobile and Last Mile Health are strong at delivering training content. So the integration between these two platforms then becomes very powerful in the continuity of service. If you're considering continuous training and enhancement in the capacity of those who deliver the care.
Well, thank you very much, Simon and Helen. And Helen, thank you for putting all that information into the chat. I noticed that you did put the website link for anybody that wants to access that for more information. So we really appreciate that. And Helen and Simon, it's great that you are doing this work. I know it can't be easy to work with COVID and all the devastating effects. So we applaud your efforts, and especially with the community health workers, that's a big part of the PMNCH focus in the coming years. It's part of our advocacy working group advocacy plan in terms of our call to action to make sure that the community health workers do have all the tools that they need to be able to perform their work, especially in situations where their own health is at risk. So thank you very much. So now let's move on to our third and final presentation. So I would like to introduce Natasha Freidus. She is the CEO of NeedsList, and the title of her presentation is the C19 Virtual Marketplace. So over to you, Natasha.
Hi, everyone. Thank you for having me. I'm going to go ahead and share my screen. And today I'm going to be speaking about 3 different pieces of our work. I'm going to give you a general background and overview of what NeedsList is, and then talk about the C19 Marketplace, which is a partnership with the core group, and then give you an actual demo of the software. So I'm just going to go into full screen mode here. Okay. So NeedsList is a tech startup that we really got started about 4 years ago in response to recognizing a real gap in the tools around crisis response and humanitarian aid. So we know that COVID-19 hits us at a time where we already have increased demand on our aid systems with the impact of climate change and migration and displacement. And so we're already looking at an outdated aid system, which has led to massive inefficiency and waste. And we've seen this over and over for decades now. I'm sure a lot of you have seen all the waste that happens on the ground when there's natural disasters or other humanitarian emergencies. And so NeedsList is tackling this problem by bringing together human-centered design, software, and subject matter expertise to power faster, more efficient, more sustainable humanitarian aid. We've been up and running for a few years now, and through our tools, we've facilitated over $2 million of resources to local communities. So we really see ourselves as a tool to address this issue of localization and identifying what is needed, where, and providing frontline workers with the resources that they need. So actually, we were planning on launching a new software tool called our crisis coordination software in June, but when COVID-19 hit, we said, okay, well, we've got this software, ready for testing. Let's figure out how to get it up and running quickly, because we know that there has to be a better way of matching these needs with offers, because over and over again, what we've seen is that people in coordination roles are sitting there with like spreadsheets or conference calls or emails trying to figure out what's needed where, and there's no tool that really maps it all out. So that's what the software is designed to do. And we reached out, got connected up with the core group in March, and together with them have decided to partner to deploy the NeedsList software in several countries to get started, to give communities on the front lines a direct way to identify what supplies were needed in response to COVID-19, what information resources were needed, and what could be shared in order to really match these needs to resources and avoid the duplication of efforts. So
hey, Natasha,
yep.
Sorry to interrupt. Are you having problems advancing the slides?
Oh.
Because we see the title slide.
Oh gosh, there's some, you know what it says?
Sometimes you have to stop sharing and then do it again. It sometimes gets locked.
Yeah, and sometimes you have to take it out of slideshow mode.
Okay.
That could work too.
Okay, thanks for letting me know.
Yeah.
Last time that happened to me, I was on stage in front of a lot of people and it was really embarrassing, so.
No, things like that happen all the time. You can't control everything when you're doing.
Okay, I'm gonna leave it out of the, oh, you didn't see all my pretty pictures beforehand then, but I'll get started here. So this is a slide that shows where we're getting started. In Nigeria, Kenya, Uganda, and Ethiopia. We're actually just onboarding Uganda today in partnership with the core group. And the goal of this project is to deploy NeedsList in 7 countries, really in order to match the commodities around COVID-19 and knowledge management and resources, to track how these resources are matched and to engage local populations. So our vision is really around the country-led localized response, sharing knowledge, creating a model that can be scaled throughout other countries, and supporting local and regional economies by connecting local suppliers and regional suppliers with these needs on the ground. So with that, even though you missed all my slides, I'm going to stop sharing and switch over to sharing my the actual web app and just take you through it. Can you guys see it now?
Yes.
Okay, great. So this is a mobile responsive web app. It is designed to be a white labeled or brandable solution. So I'm showing you a demo version, but with the C19 marketplace, it's branded as the core group. Here we've got the fictional country of Efficientopia, and whoever licenses the platform has a lot of control over how it's configured. So the first thing they can control is who has access. It's a membership-based platform, so it can be open to the public, to any nonprofit or business, or it can be limited to a specific membership group. And it is also, whoever licenses the platform can configure which issue areas you're responding to. So here you can see there's a sample COVID-19 response in Kenya. It can be around gender. We've got folks working on refugee issues. All of these issue areas can be tagged to the Sustainable Development Goals and by geography and filtered that way. And within each issue area, you've got all your needs and offers. So again, needs can be services or supplies, and starting next week, people will be able to upload what we're calling information needs, which are really related to the knowledge management, and later this summer, funding needs or offers. So offers, you can see, can be a discount on medical devices, and where it gives you a discount code that's available right here, or an offer can be a free service or supply. And same thing with needs as well. So to add a need, we've really focused on making this easy to use. It's really straightforward. If I select add a need, it's gonna pre-select the issue I'm already working on. It's gonna give my default address. I can add a new one if there's another location I want these goods shipped to. And I just start typing in here, I want N95 masks. I click on it. I can put on multiple needs at once if I want. For now, I'm just gonna add one. And then I can put on any additional information. So I'm looking at 10,000 I can put in size, brand, if there's a date I need these by, all the logistics. And once I'm done, I just click on add. And what we think is really exciting is this is the only platform that we know of anyway that does automated matching. So if there is an offer in the system for N95 masks, it'll automatically suggest it. And I can say, oh, somebody is offering these masks in Kenya. They're gonna cover the shipping, and I just have to tell them I need 1,000 and I need it delivered, and I'm gonna put in my phone number, any other information, and then I'm connected directly with the supplier. And again, I'm not gonna get into everything here, but just really quickly, we also have reporting features which allow you to see the dollar value of all the needs and offers that are met. You can sort by if there are service needs, what kind of services were needed. And so our longer term vision around this is really understanding what's needed before crisis hits as well. And finally, what I think is really exciting as well is that you can actually close the loop so if you're a local community health center on the ground and you've requested thermometers, you can confirm their delivery here as well. You can upload a photo and the donor will receive that automatically. So I want to make sure I leave time for questions. So I'll just stop there for a moment and I can keep showing other features as needed too.
Yeah, if you wanted to go back to the slides that we didn't see, we have some time for you to do that, yes.
Okay, great.
Yeah, and I think one of the exciting things about this is I think we just received a donation, or it's coming, of like 1 million masks. So even if any of you on this call that are in those countries that Natasha mentioned, if you can get on NeedsList and make a request for the masks or training or whatever it is.
Yeah, actually, maybe Nicole or Lisa can put in information of how to access the C19 marketplace for any of you that are in the countries where we're working, and I'll put in our other information there as well afterwards. I just wanted to also give you an overview of what is coming along in the product roadmap, as this is software in development. I'm very much in collaboration with our users. Is we're developing out a map-based view. So you'll be able to see what needs and offers are around you, civic engagement tools. We're actually, the rest of my team is right now doing user testing of an offline mobile version. So frontline workers who are in areas that are not connected can add their needs really easily, and it'll sync when you get back to the office with the database. So we're doing that in partnership with about 14 organizations serving refugees in Uganda. And longer term, we're looking at, we're building out an API so that if you have other systems that you're using, it'll connect with them directly on the back end as well. And again, like the longer term vision being around like having much better granular data, specifically around what kinds of services and supplies are needed in what kind of geographies, so that we can do better predictive modeling and overlay it with census data and weather data, so that longer term we have a much clearer vision around what's needed and can pre-position that before we're in the midst of crisis and on lockdown. The other thing I wanted to mention is we have a really amazing ecosystem of partners, including IKEA and SAP and a number of other companies that are really committed to meeting needs through this new software. So when you use the software, you're also accessing that network of our partners as well. So I'm just gonna leave our, this doesn't have our website on it actually, but I'll put that in the chat, and I'm happy to jump back in the software and show any other features or answer questions here.
Yeah, it's very comprehensive, Natasha. Excellent job. And I can imagine how valuable this would be to those workers on the ground to be able to get these supplies. So what was your development time in developing this marketplace?
So we incorporated almost 4 years ago, and for the first 2 years, for the first 3 years, we were using a Drupal-based platform that we developed as a way to really show what we were using, and we still use that. It's much more focused on it being a community engagement software. So it allows organizations to post their needs. It does not allow for the matching or adding of resources. So we knew all along that we were going to want to include the needs to resource matching component. And so we've been working on this version of the software over the past year, really. And so we still have our community engagement platform, but this software has been in development for about a year, and really the core group is the first full-scale deployment of it.
Yeah, amazing. So we got a question in chat. Is this platform just for health institutions, or is it also for people?
So the platform I just showed you is really a B2B, business to business or nonprofit to nonprofit marketplace, as opposed to for individuals. But it is not limited to health. It's been used in, as I mentioned, for a lot of natural disaster work. It's been used for refugee aid work or other humanitarian emergencies. So it's really designed as crisis response software, and, you know, obviously deploying and launching in the midst of a pandemic has been quite challenging. We also worked in a lot of conflict zones. So we're pretty much testing the software in some of the most challenging circumstances around. Yeah.
Yeah, I can imagine launching in a pandemic, and with the shortage of supplies, I'm sure there was a lot of scrambling to try to get as many supplies as you could. And I'm sure that they were, you know, going through them so quickly. So a question came up: can people revert on the quality of the products if they're not satisfied for some reason?
Yes, absolutely. So I can just show that really quickly. When you when you confirm your delivery here, you can actually I got to show one that is not already. You can confirm whether it was done in a satisfactory way or a not satisfactory way. So it'll give you the option to say, you know, was there any problem with this? Did it arrive on time? Was it damaged? All of that as well.
Great. And can you speak a little bit more to the civic engagement piece?
Yeah, so our first set of tools are really designed around community and civic engagement. So organizations can post supply, service, or funding needs on it and share it with their own supporters. So it's really designed to share with your own donor base. I'm going to put that link in here too. It's free to use if anybody is interested. And then what we do is we also can customize it or brand that as well. And so we're building those tools as well, the civic engagement tools, into this set of software as well. So it'll be much more robust later this year.
Right, right. You know, again, getting back to that challenge of making sure that you always have inventory and you're supplying that inventory in a very efficient way. Can the platform be used at all for estimating PPE needs and requirements by the organizations that are using it?
Yeah, absolutely. And Nicole and Lisa, please feel free to jump in on how you see this being used in the countries we're already deploying. But we know that one of the problems is people don't really understand what's needed where on the ground. So part of what the tool does is have, it aggregates all those needs in one place. So you can see exactly how many PPEs are needed at the local level, and at the national level or at a regional level, you're able to really do much better concrete estimations of the specific sizes and types and brands and all of that as well.
Yeah, that's excellent. And we've got a request to see more about your dashboard, specifically any analytics that you could share.
Yeah. So right now the dashboard and analytics are fairly basic. So we're building in tools to really better understand what demographics are being served by each specific need. And so those will be much more robust at the end of the quarter. So and so basically when you add a need, you can say these are going to be specifically delivered to women or to children or to folks with disabilities or any other population-based data that you want. So all of that data is going to be incorporated it's all tagged at a very granular level to every specific need and offer, and those will all be available through the dashboard. So you'll be able to run your own analytics. And right now we're helping out by doing a lot of that on the back end as well. And we're building in tools in partnership with users so that you'll be able to do it yourself as we really understand what kind of analytics our users want.
And is there a way for you to show the dashboard?
Yeah, hold on. So every need or offer is tied to a dollar value. That's been the metric that we've seen is the most frequently requested, is really understanding like what, so if somebody is donating in kind, what is the dollar value of that? For anybody based in the States, you know, if you're doing reporting to FEMA, that's really essential. And then you can see here, you can also break it down by category. So you can see this is medical supplies, baby supplies, hygiene. So really having all of that data in one place around the needs that were met, the offers that were met. You can also see here on your dashboard, these are all the needs I've published and all the needs that we've met. This is really a peer-to-peer marketplace. So we're not assuming that it's always businesses meeting nonprofits' needs. We know, especially in crisis, nonprofits meet each other's needs as well. So any member can post needs or offers. And of course, like under COVID, you've had all these small businesses who have needs as well too. They're not always the ones just giving. So it's really based on this philosophy that there are times we can give and there are times that we have needs, and the software allows for us to meet needs or have needs at any given time. So again, same thing goes for offers. These are all our published offers. These are offers we've claimed from other members. All of that is available on a very detailed basis.
Yeah, yeah, it's really amazing. It's really, you did an excellent job. And what, you know, you mentioned launching during a pandemic. So what are some of the key learnings that you will use in the future as you develop this technology further? Yeah,
so NeedsList was not designed as a procurement platform. It's designed as a information platform, right? Just really our assumption was that there are all kinds of resources in communities that go untapped because nobody knows they're there. And so one thing we did wrong at the beginning is we saw such a huge surge in needs for PPEs that we really focused on that. And of course, then this is at a time where federal governments and state governments and local governments weren't able to procure PPEs. So we found ourselves really kind of wrapped up in this whole procurement nightmare that we got out of very quickly. And so we really started focusing and encouraging our users to focus on those secondary needs. So beyond PPEs, we know there's a huge host of needs around food security, around hygiene, around all kinds of other issues, lodging for health workers. And so once we kind of said, okay, let's let like the public sector take care of the PPEs for now. Let's stop that for a second, and encouraged our users to focus on those other needs. We had a much better response. So here, I'm based in Toronto. We had local organizations request that we're doing all kinds of work with food security, request like kitchen appliances and all of that. And IKEA Canada came in and met those needs, you know, immediately. They donated over $20,000 of product in kind. And so those may not have been N95 masks, but they still played a very important role as well.
Yeah, I can imagine, because once people see a great service, they want to use it for a lot of different, you know, a lot of different challenges that they're facing. So it must be kind of hard to stick to a core competency in a way, because you want to help everybody and fulfill all those needs.
That's
yeah.
right.
So let's also ask Simon and Helen, you know, what were some of your key learnings that you're going to take forward as you develop your technology? Simon or Helen, do you want to chime in on that? Just the question, you know, what were some of your key learnings that you're going to take forward as you develop the technology in the future?
Thank you. That's a great question. And as I'd mentioned from the beginning, one of the very important things that we realized early on is that we needed not to reinvent the wheel. Mm-hmm. We needed not to target technology as a response to only COVID-19, but rather looking at the health systems holistically and building for scale and sustainability. Mm-hmm. Again, we're also looking at, as you had asked earlier on, how, because training is really a new space for us, is not something that we've done before. Looking at the communities that we serve, how can we be able to optimize our technology to be, you know, to work within very low resourced settings. So there's a lot of ideation and innovation going on at the moment, practically just to make sure that the technology is, you know, built for scale.
Right. That's an excellent point. And in our last couple of minutes, let's throw that question out to Anna Miluzka and Ysis Roja. So what were some of your key learnings that you were going to use as you develop your technology further for the future?
We are interested in developing the platform for working with the students. So maybe next year we will comment on the results, because we are not working today with the platform.
Right. Oh yeah, it'll be really interesting.
Yes, and Telenano, we put in the chatbot a system permit something like record health. Mm-hmm. Mm-hmm. In the chatbot.
Okay.
Mm-hmm. That's the development.
Okay, that's excellent. So yeah, and for those people that want to stay in touch, there's a lot of contact information and information about websites in that chat. So if you'd like to learn more or contact those people that have presented today. So thank you very much to all the presenters. Really excellent work and a really great job at the presentation. So we really appreciate your participation in this first of our virtual conferences. It's a different way of working that I think we're all still getting used to, but I can definitely see the advantages already in terms of being able to reach so many people and being able to hear from so many people around the world about the work that they're doing. That connectivity is pretty awesome. So thank you all again, and we are going to head back into the main plenary now. So enjoy the rest of your time at the conference and enjoy the rest of your day or evening or morning.
Thank you.
Thank you, Kieran. You too.
Yes.